There are two main things that they should be doing in the days that they have left. The first is to get testing out there. I feel like we should have learned our lesson from COVID that just because we aren't testing, it doesn't mean that the virus isn't there. It just means that we aren't looking for it. We should be having rapid tests, home tests available to all farm workers, to their families, for the clinicians taking care of them so that we aren't waiting for public labs and CDC labs to tell us what's bird flu or not. And the second very important thing is this is not like the beginning of COVID where we were dealing with a new virus, we didn't have a vaccine. There actually is a vaccine developed already against H5N1. The Biden administration has contracted with manufacturers to make almost 5 million doses of the vaccine. However, they have not asked the FDA to authorize the vaccine. There's research done on it. They could get this authorized now and also get the vaccine out and to farm workers and to vulnerable people. I think that's the right approach because we don't know what the Trump administration is going to be doing around bird flu. If they have people coming in with anti-vaccine stances, could they hold up vaccine authorization? If they don't want to know how much bird flu is out there, could they withhold testing? I mean, that's a possibility. And I think the Biden administration in the remaining days should get testing and vaccines widely available so that at least it empowers state and local health officials and clinicians to do the right thing for their patients.
Dr. Wen, is bird flu in humans super dangerous?
Well, the World Health Organization estimates that in prior outbreaks of the bird flu, that the mortality rate is 52%. 52%. However, in this most recent outbreak, it seems that most cases have been mild, and maybe some people even have asymptomatic infection. But the question is, we don't know what happens when bird flu affects more vulnerable individuals. People infected so far in the U.S. have been mainly farm workers who are working, presumably generally healthy, as opposed to what happens when you get to children, to pregnant women, to older individuals with chronic illnesses. We don't know how deadly, how dangerous bird flu is going to be for those individuals. And again, that's one more reason why we don't want it to spread and acquire more mutations.
Welcome to today's show. Buckle up, dear friends, because today's episode is going to make you roll your eyes so hard, they actually might get stuck. All right, y'all. It's happening again. Just when you thought we were done being the test subjects in some never-ending medical experiment, here comes a so-called health expert demanding that the Biden administration immediately authorize bird flu vaccines and roll out millions of doses, like ASAP. Like this is a state of emergency, allegedly. Now, you know, nothing screams trust the science like rushing another vaccine to market in record-breaking time again. And get this brilliant idea comes just days after another expert warned us on CNN that bird flu could be another pandemic. Oh, joy, right? I mean, are they playing pandemic bingo over there at the CDC? I don't know. What's next? Frog flu? Anywho, I need to share with you guys who's leading the charge this time. We need a drum roll for this one. Drum roll, please. Dr. Lena Wen. Yes, this is the same Dr. Wen who back in 2021, she suggested that the unvaccinated should basically be imprisoned in their own homes, right? She wanted to take away your freedom to leave your house because apparently breathing unvaccinated air was just too darn dangerous. Sounds like someone who totally understands liberty, right? No. And now, she's back, this time with a bird flu agenda. Honestly, I'm starting to think Dr. Wen, she just really hates seeing people live their lives. But honestly, it's a little deeper than that. So I need to take you back into time and give you a little insight into Dr. Wen's track record. But let's not forget, in April of 2021, this woman, Dr. Wen, she declared anyone who did not vaccinate their kids, you were declared anti-science.
A week here in Greene County reveals a more nuanced, layered hesitancy than surveys suggest. People say that politics isn't the leading driver of their vaccine attitudes. The most common reason for their apprehension is fear. Fear that the vaccine was developed in haste, that long-term side effects are unknown. Their decisions are also entangled in a web of views about bodily autonomy, science and authority, plus a powerful regional, somewhat romanticized self-image. We don't like outsiders messing in our business. How do we reach that mindset?
Yeah, it's a really good question. I think actually there are three buckets of people who have not yet had the vaccine, and we have to regard these three groups very differently. There's a group that's truly anti-vax. They're anti-science. They may not be vaccinating their children. I actually don't think that that's the group that we should be targeting.
Meanwhile, COVID posed, we now know this, now I knew this, but y'all weren't listening to me back then. COVID posed little to no risk to kids, and the data has been clear on that for a while. But hey, why do we need to let these pesky facts get in the way of a good fear campaign, right? And now she wants you to line up your kids for bird flu shots. Sure, Dr. Nguyen, because we all trust you so much after the last round. Now, this woman, the question we need to ask ourselves is she a crisis actor or just a regular actor? Here's where it starts to get interesting, or should I say downright bizarre, depending on how much coffee you've had today will determine which one you think this is. But I found this viral Twitter thread. Dr. Nguyen has been accused of being a crisis actor. Yes, folks, there are claims that she was performing, doing her Oscar best during the Boston Marathon bombing coverage, complete with a green screen. Now, I'm not saying it's true, because these are just, alleged things that she's being accused of. But let's just say, if Hollywood ever needs someone to push a script with conviction, she's got the resume for that. She's got the resume.
Lena Wen, she's an emergency room physician who was working at Massachusetts General Hospital the day of the terror attack. She also works at Brigham and Women's Hospital. So you were at Massachusetts General Monday. What happened?
Oh, it was a horrific day. We had no idea what was coming. It was 3 o'clock and we heard that there were 2 explosions, but we didn't know where. We had no idea how many people were coming to us.
How many people came?
It seemed like dozens, and it was. It was probably nearly 3 dozen patients in 2 hours or so.
And was the hospital ready for it? I've heard from Dr. Walls from the other Brigham and Women's Hospital that because of all the drills the hospitals here have been running since 9/11, you were unbelievably prepared.
Technically and medically, we were ready. We had done drills. We knew what to do with each individual patient who came in.
Now, my question is there a bigger agenda at play? Now here's where my sarcasm is going to turn into just a little bit of righteous indignation. The Twitter thread that I found, it points out that Dr. Nguyen isn't alone. The Twitter thread links to other, wait for it, Chinese-born health officials like Canada's Theresa Tam and Eric Ding, who've also been accused of spreading fear and panic. Now, is this a coincidence? Maybe. But at this point, I'm starting to think that there's a global fear Olympics going on, and these folks are running for gold. But when Dr. Nguyen boldly admitted that vaccine passports weren't about safety, this is what this woman actually said. I'm going to show you the clip. No, they weren't about safety. They were about coercion. Her word, not mine. This is what she said.
I absolutely think we should have that requirement. I think it was a major oversight on the part of the Biden administration to not issue this yesterday. And we have to talk about the reason. The reason isn't so much that we need to keep our train travel and plane travel even safer. They are pretty safe, although I definitely think that having a vaccine requirement would make it even safer and probably encourage many people who are vaccinated or who have young kids kids and want to protect them, maybe it'll help to encourage those people to start traveling again. But there's an even bigger reason too, which is I think we really need to make it clear that there are privileges associated with being an American, that if you wish to have these privileges, you need to get vaccinated. Travel and having the right to travel interstate, it's not a constitutional right as far as I know to board a plane. And so saying that if you want to stay unvaccinated, that's your choice. But if you want to travel, you better go get that vaccine.
Dr. Nguyen, Jeffrey, thanks so much. I appreciate it.
She openly advocated for something straight out of the Chinese social credit playbook. And now she's pushing bird flu vaccines. Honestly, I wouldn't trust this woman to tell me the time of day, let alone what's best for my health. When I was looking at this Twitter thread, it's like you can take a person out of communist China, but you can't take the Chinese communism out of them. Y'all, what's at stake here? Look, folks, this is about more than just the bird flu or Dr. Nguyen's obsession with controlling your life. Y'all, this is about freedom, liberty, our God-given freedom, and the constant attempts to strip it away under the guise of public health. You guys, if we do not push back now, what's next? We've been here before. We have seen how this plays out. A government-mandated bubble suit for walking your dog. That's what's going to be next? Like, don't laugh. It feels like we're only a few press conferences away from that. They had us in grocery stores, y'all, walking 6 feet apart. Y'all remember that? Or do you remember where you could go to a restaurant and you could wear a mask, but as soon as you got to the table, you could take the mask off? Like, make it make sense. My friends, here's the deal. We've got to stay sharp. Fear is a powerful tool. How do we know? Because we still see people walking around in masks to this day, and it's about to be 2025. It's about to be 2025, and there are still people to this day walking around in masks because of fear. And fear is such a powerful tool. And these people, these globalists, that's what I'm calling them, they are wielding it like a sledgehammer. But as Christians, the people of God, y'all, us, my people, we're not called to live in fear. We're called to stand firm in truth. You gotta question the motives behind these narratives. Be sober-minded. Keep your head on the swivel. And yes, I plan to defend the freedoms God has given me. Why? Because they are mine. And yes, sometimes that is going to mean you got to call out the nonsense when we see it. So I thought this was an interesting Twitter thread because I had heard some news stories talking about this darn bird flu. But the fact that this Dr. Nguyen chick is back, that is when I was like, yeah, the agenda, they are waiting to destroy President Trump's next 4 years with some more fear mongering and another pandemic. But I am praying that we will not fall for it and that Trump sees the writing on the wall before they start pushing this executive, this fast track authorization for the bird flu. Thanks for tuning in to the Standard of Truth podcast. Like I said, I'm your host, April Chapman. If you've enjoyed this episode, or if it made your blood pressure spike, don't forget to like it, share it, and subscribe. And as always, let me know your thoughts in the comments below. Grace and peace to you all. I'll see you next time.